The gut immune axis is one of the most important immunological concepts most people have never heard of. And fermented foods represent a practical way to support this system during flu. 70% of your immune system resides in gut-associated lymphoid tissue. The bacteria colonizing your intestines, your microbiome, actively communicate with immune cells, modulating inflammatory responses and immune activation. During flu, this system can become disrupted. Fermented foods provide beneficial bacteria supporting optimal immune function. Let's examine specific fermented foods for flu. Yogurt and kefir are dairy-based, easily digestible, provide protein your body needs, and deliver probiotics. The cold, smooth texture soothes sore throats. Kefir is thinner, easier to drink when appetite is poor, and contains more diverse bacterial strains than yogurt, often 10 to 30 plus species versus yogurt's 2 to 4. Miso soup represents brilliant flu nutrition. It's warm and comforting, provides salt and hydration, delivers probiotics from fermented soy, and it's easy to digest. Critical point: add miso paste after removing soup from heat. Excessive heat kills beneficial bacteria, defeating the probiotic purpose. Sauerkraut and kimchi provide probiotics plus vitamin C. Fermentation actually increases vitamin C content. Raw, unpasteurized versions contain live bacteria. Pasteurized products are dead and provide no probiotic benefit. Kimchi's spiciness may help clear congestion, though that same spice might irritate some people's throats. Kombucha provides probiotics in beverage form, which is hydrating. The caffeine content from tea varies, but is generally moderate. The slight carbonation might upset some people's stomachs during flu, or it might help with nausea. Individual variation is significant. The probiotic strain issue matters. Lactobacillus and Bifidobacterium species are most studied for respiratory health. Specific strains show reduction in cold and flu duration and severity in clinical trials. Products listing specific strains rather than just live active cultures allow you to research particular benefits. Diverse multi-strain products likely perform better than single-strain supplements. Preparation considerations for maximum benefit: always check for live active cultures labeling. Excessive heat destroys bacteria, so add fermented elements last in cooked dishes. If you're unaccustomed to fermented foods, start with small amounts. Your gut bacteria population will shift, potentially causing temporary gas or bloating as you adjust. Safety for vulnerable populations requires attention. Immunocompromised individuals should consult physicians before consuming probiotics. There are rare case reports of bacteremia from probiotic organisms in severely immunocompromised patients. Pasteurized versions eliminate this risk, but also eliminate probiotic benefit. Quality control in homemade fermented foods varies. Commercial products have more consistent safety profiles. Cultural variations are fascinating. Korean kimchi jjigae for illness, Japanese amazake, European sauerkraut soup traditions, and Russian kefir use all represent cultural wisdom about fermented foods during sickness. Modern research is validating these traditional practices. Timing matters. Consuming fermented foods during acute flu may support immune function and recovery. Continuing consumption post-illness helps rebuild gut health potentially disrupted during illness. Regular preventive consumption appears to reduce future infection frequency modestly. The evidence for prevention is stronger than for treatment. Actually, let me be clear about what we know and don't know. Clinical trials show specific probiotic strains reducing upper respiratory infection frequency and duration modestly. We're talking maybe 1 day shorter duration or 20 to 30% reduction in frequency. That's significant at population level, but not miraculous for individuals. The gut immune axis connection is well established scientifically. What's less certain is optimal dosing, which specific strains work best for flu specifically, and whether food-based probiotics perform comparably to high-dose supplements. My practical advice: if you regularly consume fermented foods, continue during flu. If you don't, now isn't the time to dramatically alter your diet, but gentle options like yogurt with honey or miso soup make sense. Don't expect fermented foods alone to cure flu, but appreciate them as one component of comprehensive flu nutrition supporting your immune system while it fights the infection. The bottom line on fermented foods is that they support the gut immune axis, provide beneficial bacteria, and offer additional nutrients depending on the food. They're not a primary flu treatment, but a valuable supportive component with traditional wisdom and modern research both suggesting benefit.